All right. Well, welcome everybody back to TechNest. With us today, we have Lan and Dr. Nguyen. Dr. Nguyen is a doctor and owner of DPC Health. She is board certified in family and obesity medicine and is a top doctor in family medicine. So before we kind of dive into my questions, Dr. Nguyen, Lan, will you guys please just give a little bit more of a background on who you are today for everybody to get to know you?
Sure. I'll go first. My name is Lan. I got my master's in healthcare administration and business administration solely to work with people in healthcare like Dr. Nguyen. Dr. Nguyen and I have actually known each other for a very long time. She was my Sunday school teacher when I was a kid, and she's a great mentor to me, very inspirational. And so growing up and now being able to work with her, I'm very inspired by the things she does as a doctor as well. And I love what we do. Our model is really neat, really cool, and I'm excited to dive into that with you guys today.
Yeah, it's really cool to be able to work with Lan. So I'm Dr. Nguyen. I trained at Texas A&M at Scott and White in Temple as a family medicine doctor, but then I dive into obesity medicine, and now we also do hormonal therapy and aesthetics. I mean, I just love medicine, so I do everything. We'll dive in a little bit more about the details of that later. But I went into medical school because when I was 15, I wanted to do missionary work. I wanted to give it back to the communities because we're a refugee. I was a refugee from Vietnam. And so I decided that was kind of the journey of going into medicine, and why I did family medicine was because of that, to be able to do missionary work. And I also started a nonprofit organization and all that. That's like on the other side. But as an entrepreneur, I always wanted to own my own business and do something about it. But it was very hard when you first graduate as a resident. I know Mike is a resident in the group here. It's always hard to kind of start your own thing when you begin out. So I worked for USMD at the beginning, and then I worked for Care Now, and I was just kind of all over the place until finally I had an opportunity to open my own practice. And so that's what we've been doing on our own. And it's been pretty fascinating. I love to be able to share all that in a little bit. But that's been the most exciting things of my whole medical career, is actually owning a business as a physician. I think that's very exciting. So I'll let Lan tell you guys about what we do first.
Yeah. Please tell us a little bit more about Concierge Health and everything.
Sure.
DPC?
Yeah, so DPC Health is the name of our clinic. We are basically like an alternative to health insurance. So instead of paying your co-pays, premiums, deductibles, you're just looking at a low monthly membership fee, and then you get all the services that we have to provide. Those services include things like 24/7 access to your medical team and doctor. There's an app that you can download as a member. You can communicate with us. So whether it's 2 a.m, or you're traveling, you forget your medicine, or we're just too far and you don't want to drive out here, the app is great for patients to utilize and really get in touch with their doctor, especially when they need it. We also offer unlimited clinic visits, and in the clinic, we'll take care of your comprehensive physicals. Dr. Nguyen does something that's more advanced than just like a traditional doctor. She actually will go through all your lab work. She does body composition reports. She has an EKG that she'll run through. We even just invested in an ultrasound if that's needed. So you're looking at a very comprehensive physical here with us. And then the things that you would need to go to like an urgent care or care now for, Dr. Nguyen takes care of all of that as well. That includes casting, splinting, joint injections, laceration repair, ingrown toenail removal, even birth control, implants, things like that. All of that's taken care of. And because we're also Dr. Nguyen's board certified in obesity medicine, weight loss and nutrition is included as well. So we do all sorts of things because we want our patients to have the value of their membership with us.
Yeah, and then we also do like aesthetic stuff because we want our patients to look healthy and look young. And so, we even add in some of those, because some of my patients was going to different places to get them done, and they were not like my other providers that are not physicians. And so they have issues. So then we're like, okay, I will train in it and take care of you too. So we do from neurotoxins to fillers to facelift with PDO threads to, fat burning stuff to, you name it. I have to say I love medicine, and I could not stop learning. And I've been out of residency since 2015, but it's always learning something, adding something new. And I think that's one of the things with not just medicine, right? In our world, we want to be better ourselves. For you guys who are doing business, we always have to kind of improve ourselves. So learn new things so that we can add more to the value of who we are and what we do.
Right. So as a member, you get like discounted rates for this extra services Dr. Nguyen's providing. One of our key motto, I guess, is prevention. So treat yourself is our theme this year. So treat yourself from making the wrinkles stagnant and feeling uncomfortable in your own skin, look younger, more like your younger self. And so that's why we provide these aesthetics and additional services that we have for our patients, just so that they can come to us, to a medical doctor, to take care of them if they need it.
Awesome. Well, cool. Well, let's hop into what these last couple months have really had in store for y'all. Starting off with the very beginning of COVID. Can you tell us a little bit about how COVID and other factors took you away from that partnership in 2 different locations into this journey of being a one-office solopreneur, where it's finally your own?
Yeah. So initially, we had a pretty strong clinic, and I don't know if you guys ever heard of DPC Health Care. So it used to be myself and a partner, and then we were owned by each of us has a little bit of a share in it, but we have investors that invested. We got a good amount of funding when we came in. We opened one clinic in Heritage Trace and another clinic in Clear Fork. And we were growing at a slower rate than the team anticipated, because there were certain things that different people in the team, as you have more owners, everybody has their own opinion on how we would run things. And so our growth was slower than we anticipated. And so when COVID happened, the investor drew it back. So they didn't want to invest more in, because, everything just kind of went down. The stock market went down, everything went down. So they withdraw. And so at the end of March, they told me, it was Friday was payday. And they were like, oh, by the way, you're not getting a paycheck. I was like, what? You're not, by the way, you're going to lose your job by this Friday. And we're shutting down the clinic. And I am like, what? Just now telling me? Could you tell me a few months ago so I can anticipate? So I was really stressed out and scared. But one of the things that really bothered me was one of the questions I asked was, what about the few hundred patients that we already have in the middle of the pandemic? How are they going to find a primary care doctor in the middle of all this, right? And so the other doctor and then kind of the team decided to disperse. And I said, I can't, I don't want to go back to the fee for service, and I don't want to leave the patient. So then I decided that what if I was able to just take over one of the clinic and run it? What does the financial look like? So I asked them our CEO at the time, to give me how much are we making and how much are we collecting? What's the expense look like? And so I calculated. At the time, we had 10 employees, 10 staff. And after I calculated all that, I said, we can't afford to continue to pay 10 staff and keep the clinic going. And so we then cut down to, I said, well, we can probably have 3 staff, and we have to pay less than whatever they were paying whomever was, managing. So we did that, and we were able to pretty much run the first few months. But I had a pretty big pay cut, because I was afraid that if I were to get paid the same amount of payment I get, there's no way I could continue with the business. So those were the few things that we had to do, and it was difficult at the beginning.
Yeah, and going off of that, how did you decide, which 3 and what positions were the most important when you're scaling down from 10 to 3? And talk us through that.
So that was also a headache, right? So luckily, Len and I, we've worked together on the side with a lot of nonprofit stuff, and I know her capability as as a person and her dedication, right? I just don't know all her little skills, but I'm like, I'm gonna take a risk. So I talked to her about the jobs that we would have, like how much we're paying all the people, right? We have a marketing person, we have a clinic person, and then we have a financial person. I was like, I can't afford to pay all three people, but if you're able to do this, this, and this, then I'll hire you. And then, and so she actually does job of three people for me in my clinic now. So she runs our financials, she takes care of my financials, she does the marketing, and she runs our clinic, non-clinical clinic stuff, order stuff and supplies and whatnot. So we had three people doing her job right now. So she is the one person. Then I needed a nurse, so an MA. So I needed to keep one for sure to make sure that the one that has been most dedicated among the clinic. It's hard to let go of the others, but you just can't keep up with it. So I had to let go of all the other staff, and I kept one. And then I also added another staff who is actually not certified as an MA, but then in the state of Texas, I can train them to be one. So I can pay a little bit lower, but able to do the same amount of job as long as it's untrained on my license. So those were the reason. I mean, I cut the three. I mean, it cut down, but making them do a lot more than they were. So.
Yeah, and to add on, like Dr. Nguyen's personality she's a very passionate person, so she needs people who are passionate with her. So she really built a team here that like really gets along. We're like family, and we're very all in this together kind of thing.
I love that, and I could tell that. So for everybody here, they hosted an open event a couple weeks ago, and I got to go and meet their whole team. And yeah, you can tell the second y'all walk in, just the energy and the happiness, and it's a really great place. So Lan, one question for you. When you kind of took on the job of three people, did you already have those skills? Did you learn those skills?
Kind of, yeah. So I was working for another company prior to hopping on with DPC Health, doing administrative work. I was doing a lot of roles too, but I was kind of testing it out, see what I liked, versus like really just doing it because like they had no one else. But when Dr. Nguyen kind of took me on, I just have a love for marketing. Like I like showing genuine sides of our team members. So that was really easy to put out, like, filming things that we do throughout the day or like Dr. Nguyen's procedures. So the marketing piece was definitely easy. Running the practice, I think, is more of what I was trained for, in healthcare administration. So, I needed to use my degree at some point. So that was the part that I got to use. And then finances was something that I definitely had to learn, but I was doing it for another company. So it's an acquired learning process that I had to go through for myself.
Cool. And then Dr. Nguyen, back to you, with where you went with downsizing the staff that you had. I know that you said that you cut back for a couple months on paying yourself. So what did you guys have to innovate? What did you have to do differently to get those revenues back up to where they were at? Did you have to go out and find new patients? I know you were talking about you're always adding new procedures. So yeah, talk us through that a little bit.
Yeah. So, when we had two doctors, so like more than half the patients were mine. And then the other part was my partner. And so when he left, some of the patients came with him because, it's been with him for a long time, and I understand that. But a lot of the patients decided to stay, even some of his patients stayed, is because of the model that we're able to provide, right? It's like patients can call us at any time, 2:00 in the morning, they're throwing up, they're calling us, and we can help them, versus like when you go into a fee-for-service world, and I don't know, you guys been to a doctor's in a clinic, you have a cough or a cold, it takes you about a week or two to get in, and you can't get a hold of anybody when you're on the phone. You wait for 30 minutes and then sometime an hour, and you call back. And so it's the conveniency of it that the patient who even was my partner's patient, they stayed. And so a lot of those, we didn't lose as much as patient as we thought we would. We thought we would lose like at least half of it, but then we actually was able to keep a lot of the patients. So only a few was leaving. So that was nice. So we used to have some of the income. And then Lana's really good at marketing. So I don't know if you guys ever like have a chance to watch some of our videos. It's very genuine, right? So we try to be as genuine as possible because we are kind of like a family. And so we were able to bring in a lot of the patient. And then I add in a lot of the services. I mean, I've always been passionate, like I've mentioned. We provide more than what other doctors, other place would do. So for example, if a patient is needing hormone therapy, for example, we do pellet therapy. If they go outside to a like a hormone clinic that's run by a practitioner or something, we don't run by a physician and do our own pellets. It could be like out there at $700. Our member, we would give them 20% off. So ours is only $450. So our numbers is much better. So then those are the extra services that we add in. And if we need to do anything extras, we you know, like I was talking about the Botox, the neurotoxins, the fillers for, you know, making people look pretty and young and stuff like that. Those are things that are added with a discounted rate. As a member, they always get VIP stuff. And so that's why patients are coming in to see us. And our treatments are so effective. It's just that before we didn't have a marketing team letting people know that, hey, she's really good at weight loss. Look at this before and after pictures. We just didn't have that, telling people that. So Lan is really good at helping us with the marketing piece. And so it's just the fact that word of mouth, like telling people what we're doing. And then because we're so compassionate in a small team, there's only 4 of us. So we're very dedicated to our patient. And so patient has get so good at enjoy what we are able to take care of them. Then they tell other people. And then one of the big things we did was Google reviews. We did not focus on Google review when we were in the other practice. We had like 7 Google review, even though our team was really strong. Like we were good. Our patient loved us, but we never asked them to do Google reviews. And so just in the past few months, we're now up to like 100 and something Google reviews. And that's a big thing. People look at, you know, when they look for us, they're looking, oh, I want to know, is this doctor good or not? And if they confirm that this doctor has 5-star Google review, not just her, but her staff, her team is strong, then they're more likely to come in to see us. They're like, oh, that confirms that she is good. My friend told me she's good, but now all these review other people telling me she's good. So therefore they would come in. So that's kind of how we start building. And as we're more consistent with patient growth now than we were at the beginning, because we were losing a lot and then we were just like slowly growth. But now it's like people are telling other people, and then we're getting Facebook, you know, marketing, and then we're getting reviews. And I think that's what really brought our growth up pretty rapidly, even though we were a smaller team with less amount of budget.
Yeah, just to add on, I think with COVID, patients like they couldn't just go to a doctor anymore. Like you had to go, even if you had a cold, doctors make you do COVID testing and all these things just to see them. And so I think us being able to open the business and like be able to be there for the patients, that mattered a lot. And then some patients like lost their jobs, lost their insurance, and so they needed somebody. And the neat thing, like Dr. Nguyen is saying, is our team is very compassionate. So, you know, you call me, you have any questions, I can definitely answer that, get you on the schedule same day if you need to. The medical team, they're really good at just getting to know the patients, rooming them, taking care of them. And then Dr. Nguyen, she'll spend an hour and a half with patients if they need to. Like she's going to build that doctor-patient relationship. So I think that's like the key component that we have here at DPC Health that other doctors don't have.
Yeah, and that's one of the things I'd have to add to that is like we don't rush patient out is because we are a membership-based clinic, right? So most of if you go to a regular doctor's office, you have to go in 5 minutes, the doctor's like out because he has like another 30 patients waiting on him or whatever. So our model is based on membership based. In other words, we cap our patients. Not everybody gets to come in to see me unless they're members. And so therefore our members is truly VIP. So if it's something like that's not like if it's a cold or something or a sinus or they're just traveling, they just need to talk to me, we do a phone visit. I don't have to have them come into the clinic to charge them a fee, like a fee for service clinic. So therefore our clinic waiting room is not full of people just waiting to be seen for like a fever blister or a common cold. You know what I'm saying? So therefore they have a lot. When I am actually seeing the patient, I truly give them the time that they need and not like rush them out.
Yeah. And I think, I mean, I could tell how much y'all care about people just, from the little that I've seen. So I think that's a really cool aspect to y'all. And one of the things that both of y'all touched on was all the new types of skills that you've had to pick up along the way, which is, anybody that has anything to do with entrepreneurship knows how many skills, you think you enter into something and you'll only need to do X, Y, and Z, but then it's X, Y, Z plus A, B, C, D, E, F, G. You have all of these tasks have to do when you're kind of going it off on your own. And for a lot of people that causes burnout or, kind of some distaste for other aspects that they used to love. So, but y'all seem both so passionate about what you love. So how do you combat that type of burnout from maybe tasks that you didn't used to have to do that now you do?
Yeah, I mean, to be honest, sometimes I do feel tired because I do have a lot of patients that like after hours we're calling, and things like that. But there's one thing that I have to say is I love my job. I really do love medicine. And I think that being able to improve somebody, like, for example, if somebody who comes in to see me for weight loss, they follow up and they lost like 20 pounds and they're feeling great. And it just excites me that yes, that time that I spend with them, a full hour going over the nutrition, going over what's causing them to gain weight, blah, blah, blah. And it's working. They listen to me and we see results. Their blood pressure is down. I'm cutting off the medicine. So it's the result that we get from what we do drives me even more. Sometimes I'm like 2:00 in the morning, I'm still like looking at, this doctor does the procedure this way. How do I do the block so it doesn't hurt them as much? So I'm still learning, like 2:00 in the morning, I'm still YouTubing. What are they doing? This is how I learned. So that's how an entrepreneur should be. I would not have done that if I was when I was working for somebody else, 5:00 done, I'm out of the door. I don't care about answering messages. I'm not going to answer things because it's not my business, right? But then now it's my business. I want to make sure my patients are happy. They're not in pain when they come in to get a procedure done or do anything, is because I want that quality of care, not just getting it done because I work for somebody paying me an hourly. This is my business and I want that business to continue to grow. And I want my patient to come back. I want my patient to walk out of there and rave about our business so that other people can come. And not just like, in our business, in any kind of business, right? A restaurant, the same thing. So I think that's one of the things that we're passionate about is we work really hard to make sure that we provide that quality care, whether it is for me. Sometimes I don't know the answer. I mean, there's so much in medicine that I don't know. So whenever I don't know the answer, I will look it up and keep asking until I find the answer. And that's one of the things I have to say is that's what really make us so strong. And even though when we do feel burnout, the return that the patient gives to us makes us not feel tired.
Yeah, I agree. It's all about the patients. In the past, I've always been on the clinical side of things, like, filling prescriptions or visiting patient rooms in the hospital setting. So doing administrative work, I was kind of sad, like I won't really get to know patients anymore. But Dr. Nguyen has been very kind with me, letting me like still learn some like things that the clinical team does. So sometimes I'll hop into a room so the patient like still gets to talk to me, or like when they're messaging me, we really get to know each other. We have inside jokes, things like that. So it comes to a point where sometimes patients come in, they're like, is Lan here today? Like she's not working today. So like having that patient relationship with me is also very important, and seeing that satisfaction that they're having with their healthcare, it means a lot to me. And that's what drives me too.
Sorry, my mute and unmute is going in and out. No, I mean, that's just incredible that y'all were able to add in what really makes you passionate about the process and everything. And you can tell, I mean, they say that the best entrepreneurs are those lifelong learners. And it's so cool. I mean, to be in medicine, you have to be that to keep up with everything that's new. And it's cool that your practice specifically is always adding in those new procedures, like everything new, you know, what people are really interested in. So that's so cool. One question that I had back on the business end of it, when you went from DPC healthcare to health, did you have to change the business plan at all? Did you have to go back to those older documents and, you know, change how the business is written, change any, you know, handbooks, anything like that? Or did you kind of just go, was that a big research project, or was that kind of gut reactions of what you guys felt would be the right movement going forward?
I think for Dr. Nguyen and I, like Dr. Nguyen was working in the model, and it was the first time I've ever heard of something like concierge medicine. And it sounds amazing. Like it sounds like it could work if it's done the right way. So for us, it was a matter of just taking on the model and making it ours. And so that's where Dr. Nguyen kind of came in. And she was like, well, I was limited to not being able to do these procedures or do these services, but now as the owner and as the full-time doctor, I get to do these things. And so I think, you know, we really took on the model, made it our own, but it's still, you know, a concierge medicine model.
Yeah, and then one of the things that me and Lan kind of sit down to do was like, what did we do right in the old model, and what did we do wrong, right? So it's kind of always learning and go. So what is it that costs us more money? Then we need to kind of change it. And then, so like, for example, gowns, right? We used to pay a company to do, to like wash our gowns and then not like lease from them. And then it was more expensive. And then I was like, why don't we just buy our own gowns and then have somebody like wash and dry it and like clean it and bring it back for us? So we save a lot of money doing that. And I only have to pay that first beginning things that we have to pay. So then we look at all the financial, what is our cost? How can we lower the costs based on some of the adjustment that we can do? Like, can the team take out their own trash? Like, instead of like hiring somebody to clean out the trash, things like that, like small team. Or do I need to hire an IT guy to do this? Or can somebody help us with that with a lower cost? So we kind of pretty much look at what our cost looks like, and then what can we cut off so that we can save as much money as we can, but still be functional. But on the other hand, we also then say, hey, what about people without insurance? Like if they just need telemedicine and they live in California or something, and can we put up a plan for that? Or we just say no. So we add in other services like a telemedicine plan only, that we can make extra income without having to deny a patient who, say, live in Oklahoma and need telemedicine services. Does that make sense? So we just add in more things to make more income that doesn't really take away much from our clinic. It's still, you know, I still would like take 10 minutes out of answering messages for these patients.
What so kind of now a question about both of you. I have a couple of questions that kind of dive more into who you guys are as entrepreneurs and as, you know, business owners. And what do you think during this whole transition from healthcare to health, what were the biggest traits that you think helped you through this transition?
I think I'd have to say our persistency. Like, I just know, like, this is one of the things is like, I know what it was like in the fee for service. I was at USMD and I worked at Care Now, and I was just like a physician machine. Like, just, I could not do certain procedures. Like, my patients have a bad migraine. I needed some medicines to just break the headache. I know how to do it. I know what medicines have. I can't get somebody to order the thing for me. So because there's like layers of people above me. And my thing was, I ain't going to be able to go. I can't go back to that world. So I have to make this work. That's one of the things. I have to make this work. But one of the things is I know that I'm really good at what I do. So if I'm able to be persistent and be the best that I can be, my patients will stay, and then they will tell other people. And this is how we're going to grow, is because we believe in it, right? So if I believe that I can do it, I will be able to do it. If I keep saying, you know, I ain't going to be able to make this, or I'm not sure if we're going to handle this, then we would have never been where we are today. We believe in ourselves. I think that's one of the things, and we work hard, and we know that if we work hard, we will we'll get a payoff. And I think that's what really one of the big characteristic of our clinic, of how we were able to continue to proceed.
Yeah, I agree. I think Dr. Nguyen and I are very optimistic, or we're very positive when we need to be. And I think that was very important. I mean, I'm going to be honest, there were times where our numbers of patients dropped very low, and I just didn't think we would make it. Like, there were times that it was hard, but we picked back up and we were very strong about it. And I think that positivity is just, it kind of spreads everywhere. Like, if I'm taking a meeting with a potential patient and I'm positive with them, they're going to see that and they're going to be like, okay, this is the medical team that I want, or with the business and whatnot. And so I think just keeping a good mindset and like be staying focused to your goals, I think that's very important for any entrepreneur who wants to be successful in that way.
Yeah. And I would say, like, we also make small goals. So if, like, you ever see Lan's office,
True.
she writes like, okay, we have to meet like 10 patients this month, or how many, new patients need to be added in on this tier or that tier, or how many pellets we need to do in order to meet our goals. And so we make small goals, or how many 5 stars do we need, or whatever. So those tiny little goals every month makes us feel satisfied, and we celebrate as a team. So like, hey, we meet our patient goal this month. Let's all celebrate. Let's go out to eat. Even though financially I might not have to get paid yet, but we're meeting our goals. That means we're moving toward the right direction. And so that's how we really kind of proceed, is that tiny little goals. As long as we make it, we're going to make the big goals.
Yeah, I agree with that. The goals are very important to me, especially. Just fill my whole office with it.
I love that. And let's see, we have just a couple minutes before we start our community Q&A. So again, everybody in the room, feel free to start putting your questions in the chat, and I'll start asking those right at, sorry, my Chicago accent's coming out. I'll start asking those right at 5:15. But one of my favorite questions that I want to ask y'all, especially because you're so fun and engaging and just excited about the work that you do, is what, you guys really did persevere through COVID, and you continue to do so. So what has been probably like your best, your coolest moment in the last couple months? What did this new opportunity provide to you that, you wouldn't have been able to do before, that really sticks out to you?
I'd have to say is, like, I would never imagine I've done like so many things in a practice, right? Because I always had a limitation, either working for a big corporate, and then there's a limitation of what I can do. And then also, like, when I was working at with DPC Healthcare, we also had like CEOs, CFOs, and all these other people telling us, like, you can't do this, you can't do that, or whatever. And this is like the first time I'm able to do what I want to do as a doctor. I have no limitation as a physician. So in other words, like, I want to buy an ultrasound to be able to get patients who I can't get access of IV. I just buy it, and because giving my patient quality care. And I need to buy certain medicines to help patients with their headaches, or do a certain procedures, or like I want to add in PDO facelift thread to make somebody, skin not sag without surgery. I just do it. I mean, that is one of the things I'd have to say is, like, through this pandemic, it is a curse, but yet also a gift to allow us to be able, for me as a true physician, to practice medicines the way that I want to practice, and improving my patient's health without having to report to somebody else that is not a physician, that's in control, So that's one of the things that I have to say is most satisfying for me.
I guess for me, I didn't really realize that I was taking on all of these roles and positions. I think the first time someone said I was like a jack of all trades, I was like, oh, I guess you're right. That's pretty cool of me. But I think a moment that really clicked for me was in December, we went out to an employer work site, and out of a whim, I was kind of like, if you're having an employee meeting, please let me come in. Let me explain what DPC Health is, so that maybe your patients or your employees might want to become our patients. And I went in there, I literally gave a 5-minute like spiel, hey, this is me, this is what DPC Health does. And by the end of that, or by the next month, we got like 50 new patients from that. And we met, like we surpassed our goal. I relaxed all month saying like, oh, I'll see you next time. But I think that moment was very important for me, just because I felt like what I'm doing is making sense and it works for people out there.
So, and then one other question that I had, again, about how y'all have changed through this is, I mean, you guys are truly leading, you really are doing this incredible job leading your organization. What do you think has changed? And you hinted at it a little bit earlier with both how you have changed from previous jobs into the one that you're doing now, but even just recently, how do you think your leadership styles have changed?
Yeah, I definitely think that I learned a lot about how to be a leader. I think it all has to do with spreading the positivity, staying calm during situations, and being able to communicate. I think at the beginning, it was definitely a learning process, but as we're getting through it, I think the reason we make a great team is because we're communicating right, and we're using all of the good skill sets to stay positive and stay calm despite what's happening. And kind of doing that, leading the team, I think it makes the enjoyment of working and coming to work every day a lot better.
Yeah. And I think as for me as a leader, I've never really been the head of the team, right? So this is my first time leading the whole, this is my business and everybody. So when we had issues before, I just okay, complain and then, not really think about how other people think or how their emotion is. But now as a leader, I want to make sure my staff is happy, even though if somebody is doing something wrong, one of the staff is, missed something or something like that, I call them out because we want to make sure that we don't make the same mistake again. But at the same time, I want to let them know that they're very valued. I'm telling them to fix it is not because I am judging them, because I want us as a team to give the better care for our patient. But at the same time, I want to let them know they're still valuable. So there's that piece of sandwich that we always talk about, you give a compliment, you give the bad portion, and then you give another compliment, right? So, but that's a skill that I had to kind of really learn and improve, because it's not only affecting just our staff, but if they have a bad attitude or they don't like their job, it's going to affect our patient. And so that's one of the things that as a team, we really and I also have to kind of watch among the staff, right? If this staff is not, I can sense that they're not having a good relationship with the other staff, then I need to make sure that I pay attention to that, or else there's a vibe between there. And that had happened in the previous clinics. And I usually don't say anything because I'm not the leader. Now I am, or if not, it's going to affect not just our staff, but it also affect our patient. And so this is something that I've learned to be a lot more patient, a lot more calm, and then thinking about what am I going to say to this staff or that staff so that it doesn't hurt their feelings, but making sure that we get the problem fixed so that we don't harm our patient or get the patient care properly. Does that make sense?
Mm-hmm. Yeah. And what's funny is while you're talking about that, that's something that I've also been trying to learn right now about my leadership and just in general. I think that's a big trend shift right now that's happening of how do you correct people, but also show them care, so that they don't disengage, but they know you care and they know that it's for the betterment of the whole organization. So I think that's really cool that's something that y'all have seen as well. Cool. Well, it is right at 5:15, so I'm going to hop over to some of the community questions. But before we hop over to those, thank you for answering so many of mine. I still have more. So feel free, everybody in the room right now, you can go ahead, drop your questions in the chat. If you want them to be anonymous, you want me to read them out loud, go ahead and just send them as a direct message to me. But let's see, one question that came up was for Dr. Nguyen. Shortly, you're about to add a new title as mom to your large background and range. So what have you been doing to prepare? a lot of people entering into that, you know, as they say, the mompreneur, adding in that title can sometimes change things. So what have you been doing to, you know, put all your ducks in a row to get prepared for the next couple months?
To be honest, I'm scared. I've delivered 40 babies, 50 babies, or whatever. I've been able to handle that just fine when I deliver somebody else's baby when it comes to mine. But I do have another physician of mine that we train together in residency will help take over while I'm gone. So I have that in place. My mom's coming, so she's going to help me take care of the baby. You know, I've always loved medicine and always like put my patient first. So this is going to be something different that will put the baby has to go first, right? But at the same time, I have a very strong team that the team most of the time can handle like what to do with the patient. And then if there's anything that my partner can't handle, then we'll take care of. But I am nervous. Raising the baby per se, not so much of the delivery itself, but I'm excited, and we're having a girl, so we're really excited. My husband is super excited, but he's always been very helpful. So he's already planned he'll be changing the diapers and doing all that stuff. So we'll bring the baby here. Lance said she'll watch the baby while I see patients.
I definitely will. The baby will be part of this team.
Yeah. So.
Oh my gosh. Well, what a great community that, you know, you get to bring this new baby into the world with. Let's see. One other question that came in was around culture. So how did you, because at the beginning of COVID, everybody, you know, everything was unknown. Everything was scary. You know, especially being in the medical field and having to be kind of, you know, a frontline worker with all of that. So how did y'all shift from a culture of being scared in the general populations to a culture that y'all are today? You know, you give off a very strong, very trustworthy, you know, very welcoming, again, Lan, you said optimistic. You guys very much so do give off that. So how did you make that culture shift?
With COVID, for sure, I think I was very scared, but the fact that Dr. Nguyen, a medical doctor, was very calm through it, I think that passed on to me and probably the rest of the team. So I really wasn't too afraid as we were, you know, taking care of COVID patients, because she had like something in place for us, and she had that positivity vibe that made us feel comfortable in doing our work here. Yeah, and I'm sure she can elaborate on that, Dr. Nguyen.
Yeah, so like we have a protocol in place, right? So just like everybody else, everybody has a protocol. So we also have one, and we're actually a little bit more on top of things because we want to make sure that if everybody has a COVID rapid test, we have to have them too, because we want to make sure our patient has what they need. So we're like, you know, everybody's trying to get on it. We're going to have to get on it. And I tell Lan, we got to do it before everybody gets on it, right? So we have the way the protocol goes is that if a patient who has COVID symptoms, we can do telemedicine, and then because we already have that in place, so it's not anything new that we're struggling with, because we already have telemedicine in place. So we do a video chat or a phone chat with them, and then if I'm concerned that they have COVID and I need to get them tested, they would drive in the back of our office. Our staff would gown up and wear our N95 masks and come out and swab, and would be, you know, we already got that from the beginning. And then if they have symptoms or anything, I would call in medicine to treat them over the phone. And then if they have other questions, we just take care of it. And so if there's very few patients who are really like COVID positive that I need to bring into the office to treat, those are like, I have a really like elderly patients that need to do that, because I need to like give them breathing treatment and whatnot. So we would just kind of gown up with our N95 mask. I know what to do. And then after that, like we wipe everything down, and nobody else is in the clinic while this patient's there. So, because we don't want to expose it to other patients. So we have different protocol to make sure that our team is safe, and then our other patients are safe. And so I think that really, because of the knowledge that we have, it makes our team be very confident, and then our staff are confident, because, you know, we know that we're doing the right measures to prevent that from us getting sick ourselves.
Yeah, cool. Yeah, I would definitely say, I mean, I think confidence is a really great word to use, where y'all really, you ooze confidence when you walk in the room. So that's great. So thank you for answering that question. The next question is from Ronnie. She said, I love the lessons of, what y'all said of going the extra mile, of the positivity that are really, sewn into your journey. Her question is, what is the first thing you do in the morning to start your day off right, that you feel helps you gauge your whole day to success? What are those little things?
So I guess for me, I'm always like in the morning, I wake up and have a warm glass of water. So that's one of the things that I teach patients. It jumpstarts the metabolism. So that's what always important. But we try to, when we're not super busy, every morning in our clinic is actually, we do a huddle where we kind of huddle with the team, go over all the, so Lan has this list of like what are you grateful for? So then we go around and say, hey, what are we grateful for? Are we grateful for electricity or water or whatever? And then Lan will go over the numbers of patients that we have this month. Have we met our goal? And then how many 5 stars do we have? And then we go over the patient that day or that week to make sure that we're pre-planned. Like, okay, this patient's coming in, what are they needing? So we plan ahead of time, and so that we don't have to rush. And so those are the few things that we do. And I think the morning huddle is really nice. But sometimes we're just super busy. We're not able to squeeze it in, but that's one of the things that when we're able to do, it's one of the most a positive thing in our clinic that I really think uplifts the whole team.
Yeah, for me personally, I like those weird apps on your phone that just sends you like motivational quotes throughout the day. So I do have one of those. I read one at least every morning. And then of course, like my own personal preference is to do a prayer, praying for a good day, praying for everyone's safety. And then, yeah, coming into the clinic, like our team here, we're family. And so I know if I like had a bad night or something happened, like I can just go in and kind of talk to them about it. And the same with them and me. So when we come in and we say our good morning, sometimes it's like, hey, this happened yesterday, I need to tell you about it. And so, that kind of starts the energy for the day, like being able to open up ourselves and just being a team for sure here for our patients before we have to see them.
Awesome. I think those are great. I need to add in some of those to my day because I want my day to look like y'all's days. I'm just happy. Well, cool. Let's see. Let's see.
Devin,
go ahead.
Yeah, I have a comment and a question. First of all, here's the negative Google review. I am a member of DPC Health, and the first time I went, I was told so many negative things about what I was doing with my body that I was there for lunch and dinner. That's how long the doctor spent with me. But could you tell everybody how much it costs to get all these services? I mean, you must be charging outrageous rates, right?
You're right, we do. Our rates range from anywhere from $60 for a telemedicine visit or $80 to $125 for all of the services that we have. So yeah, it costs an arm and a leg just to see a doctor. I'm sure Bruce is just kidding, but yeah, our rates are very low cost for a monthly membership, $80 or $125. You get all the services that we have. The only difference between the two plans is the $125 covers unlimited labs and injections. And so if you're somebody who needs those kind of things, you don't want to think about it, that works well for you. If not, $80 suffices as well. And we're here for our patients, no matter the cost.
So what do I do about hospitalization or things like that?
Yeah, so we have worked really hard to come up with catastrophic coverage for our patients. We partner up with a few different things like health sharing, even high deductible insurance plans, even like Aflac, I think they have their own little plans that they have coverage for. So we're here to navigate for our patients. We'll figure out what makes sense for them and their budget, and then we'll give them some options that would work well with them. So the catastrophic thing, even though we can't provide it, there are options that are affordable that our patients could afford.
Yeah, no, one of the things that we really try to do is actually not have the patient to go into the hospital, because that's the idea of the membership, right? Is to prevent. So like as Lan was saying, so that's the reason why I do so many things, right? Ingrown toenail removal, you got a fracture, I'll cast you and splint you. And if you like, we do IV hydration if you're throwing up, or post-party and you drink too much, and we do all that too. So like we do a lot more than an urgent care care place. And then, like we do a lot more. And we, even with IV hydrations, when you go in the hospital and you're really dehydrated or feel bad, they just get regular IV hydration. We do nutrition IV hydration also, like Myers cocktail and things like that. So we go a little more beyond than say something a urgent care and ER would do. So like, for example, I have a patient in the middle of the night, on the weekend, the kid had like a big laceration in the ear. Now you take him to the ER, it's going to cost him a few $1,000s, but you're a member, it's free. So I just come in on the weekend and meet him at the office and just sew him up. And, 10 days later, I come in, cut up the suture. And so that's all part of the membership. And so sometime with things like that, it really saves, we really try to prevent them from going to the hospital to save them that money. But a lot of people will get like a high deductible plan to make sure that they have all the catastrophic covered, or like Lan was saying, the health sharing to cover from the hospitalization. But we really, really try our hard to keep them out of the hospital.
Awesome. Bruce, do you have any other questions to add on? Well, one other question that I have just before we do some closing stuff is, can you tell us a little bit about the nonprofits that you work with and, your passion behind those?
Sure. So I, like I was mentioning, when I was 15, I saw Operational Smile on TV, and I'm like, oh, I want to do missionary work. And that's why I wanted to become a doctor. It was a really hard journey becoming a physician, but my dream was to do missionary work. And so in 2000, so when I went to residency in Scott and White was because they did a lot of missionary work in Nicaragua. So I went with them 3 years in a row, learning the steps of it. And in 2015, I graduated residency, and I wanted to fulfill that dream, doing missionary work. And my language is Vietnamese, so I can speak Vietnamese, and there's a lot of underserved communities in Vietnam. And I had a lot of connections over there due to families. So I took a team of 2 or 3 of us to go over to Vietnam, and we went to visit the nursing home, the orphanage. So I did, when we went there, we saw a few hundred patients just in a few days, but it was very tiring. And there was a lot of things that the disabled children and the poor dental, there was just so much that we could not do as 3 physicians that went with us. So then I came back to the US and decided to form a group of people to come together. And so, had about a few dentists that came with us on a mission. Our organization name is called Hand in Hand Share Mission. We started in 2015. So the first year we went back, I brought 20 people. It was physical therapists, dentists, other doctors. So we did medical care and dental care for the children that are in the orphanage that was left by their families. And then also the really, really poor people in the village, not just seeing them, but also treat them with medicines and then further that. And then as the year goes on, we went every single year except for last year because of COVID. Our team continued to grow. And the thing with us is everybody goes on the mission, even myself, everybody who's on the board don't get paid or anything. All the donation that goes to the organization go directly to the people. So when we are there, we've also now teach them how to take care of themselves. So we teach the nuns and the caretakers how to do wound care, how to do CPR, like when we're not there, what happens to the people, right? So our goal is to continue that care when we're not there. So in the past years, we've grown so much, but we're not only just help the poor people in Vietnam, but we encourage the youth that is in the US to be able to join our team to see what it is like to give back. So to become a doctor or an engineer or a dentist or whatever is not all about money, but it's also about giving back. When you give back and then the Lord gives you so much more in return. And like just speaking about me and Lan, we do a lot of nonprofit stuff and we see it in return, like not even asking for it, but our business is growing really well is because of the good things that we do. And I believe in that. And so that's one of the reasons why I keep I keep pushing, doing missionary work, not so much about like what we want to get in return, but because we're actually role model for these young people, is not about just making money, but also learning to give back to the community. And that's one of the things why our nonprofit grows so strongly, is because we're really compassionate about giving back. And what can we do to help these people, not just like the dental work, but also their health. And then the other things we do is for people who are really, really poor, who doesn't have money to get, say, a surgery done or certain things that we can't do, we actually continue to sponsor them, like pay for their surgery if there's no way that they can do it. So it's something that's really rewarding on the side that we do, in addition to the business of what we do here.
Yeah, and just to add on real quickly, I'm the secretary for Dr. Nguyen's nonprofit, and here actually I do more of the United States stuff. And so here in Texas or in Arlington, DFW area, we actually do local missions for people who don't have insurance, who just need that kind of care, that couldn't see a doctor. And so we've seen over like thousands of patients just here alone, and that has been amazing. And we get the youth involved and have them volunteer, and they get to, you know, be dental assistants for a day or medical assistants, and it's really fun for everyone in the learning process.
Yeah, absolutely. And so we do that in Arlington. So like this past year, we did host a free flu clinic. And then the year before that, we had a full dental, medical, optical, like thing. We saw 500 patients in that one day. So, I mean, we do a lot for the community. And that's one of the things, is that getting the youth involved. That's one of the big things that we're passionate about, is to get them to see what it's like to give back, and not becoming a doctor just to make a lot of money, or becoming a dentist to make a lot of money, but also learning that there's more to the world than just ourselves.
Awesome. Well, thank you guys both so much for being here today and for answering all my questions. I know when Bruce and I first had the conversation of bringing y'all in, and then when I actually got to meet you, I was so excited to host both of you, truly because I know for me, just being around incredible, passionate people, like it just helps me so much to feel better about, you know, the world that we live in, and just the people that are out there doing such good work for others. And I can confidently say I think you two are two of the best people I've ever met. So thank you so much. Yeah, and thank you for spending this time with our community here. I know, Lan, you just popped all of your information, so if anybody is curious, go ahead, save that information. It's in the chat room right now, and feel free to email me if you have any other questions for them, or, you know, feel free to reach out right to them if you do. But I hope everybody has a very safe and healthy week. And then we'll be back with regularly Tuesday afternoon programs next week. So have a wonderful week. And again, thank you, everybody. Have a safe day.
Thank you for having us. Have a
Yeah,
great
thanks
day.
for having us. Really enjoyed speaking with everybody, and hopefully see you guys next time.
Yeah. Oh, wonderful.
Bye.
Bye, everyone.